Thank you all for coming. So my name is Miguel Vargas. I'm the clinical director of Balance Physical Therapy in Salinas. This is my colleague, John Schott, physical therapist. And today we're going to be talking about preparing for a joint replacement. So fun fact about me is I just had my second son. He's now two months old. Which is pretty exciting. I got my doctorate out of Fresno State.
I went to University of California, San Francisco. And fun fact about me is I just moved back here. I grew up here, but I moved back from New York City. I left there in early January, so I got out just in time back to home. So,
yeah. So why do we need to replace joints? Well, with time, our joints just will naturally degrade, and it's a normal part of aging. There's nothing there's nothing wrong with you. There's nothing wrong with your body. It's normal. There are some things that can affect this as far as how fast they degrade, and those things can be your lifestyle, genetics. So oftentimes people say, oh well, my grandmother, her fingers, and she had rheumatoid arthritis, so my grandmother had it, my mother had it, so I know I'm going to get it because my joints already hurt. And so those things do happen. And so what it is with that breakdown over time, that means that there's loss of joint space. So if you see here in this diagram, this picture here, this is the top part of your knee, this is the bottom part of your knee. They removed the kneecap so they can see it better. So right here, there's a nice normal joint space. You have a nice little gap there. So when you see an x-ray of your knee, there's always a black line right here, okay? That black line is there because it's space. There's just emptiness there. This other picture to its left, you can see there's a lot more cartilage loss. There's a lot more breakdown of the joints. So this is when your orthopedic surgeon says, "Oh, your knee's bone on bone." This is what they're kind of, this is what they're trying to get you to visualize and to understand that this is what's happening. Just because you have arthritis doesn't necessarily mean you have pain. Like I said, arthritis is a natural part of aging, and it is a natural part of life. But some people, when they move, their joints make all sorts of popping sounds and this and that and squeaks, but that doesn't necessarily mean they hurt. So what is a joint replacement? So I want people to really understand what the process is and what they actually do to your body. So what they do is, the top part of the femur here, they actually cut this part of the bone off, okay? So it's essentially very high-tech and fancy carpentry. All right, so I want you to understand that because there's a reason why people complain of a lot of pain and swelling and soreness and it hurts. So they're actually cutting this top piece of your bone and the bottom piece or the top piece of this bottom bone right here and replacing those with new components. When it comes to knee replacements, most of the time you will be told, let's wait a little bit more, let's wait a little bit more. And the reason for wanting to wait as long as possible is because the replacements that they give you don't last as long as your original parts, okay? So your original knee that you were born with, that's your natural knee that you were born with, has a lot more longevity than what they're going to give you. What they're going to give you is going to last about 15 to 20 years or so. That's about the lifespan of the new knees. So that's why sometimes they'll say, no, you have to wait. I know it hurts, but you have to wait a little bit more. You have to wait a little bit more. In some occasions, partial replacements are also an option, and so that's something that you should really be discussed with your surgeon to see if you're a candidate for one of those. When it comes time to your hip replacement, they give you options. So sometimes, depending if they think you're a candidate, your incision will be in the front, which is more anterior, or your incision can be on the side, which is more lateral, or your incision can be right behind, right through that glute, and which is posterior. Every surgeon has their own preferences as far as how they want to do things, and oftentimes they will choose how they do it based on the patient. And your surgeon will be better able to give you the rationale and the reason why he or she is choosing to do a specific replacement style. But similar to the knee replacement, they're cutting the head of the femur. So right here you can see on this picture that they've replaced the head of the femur with a nice shiny ball, metal ball, okay? And then on the acetabulum, they've ground that out nice and smooth and put a nice metal cup there. They often put a ceramic sleeve so that it's not grinding metal on metal. It's nice and smooth and it articulates really well. But because of all the cutting that I mentioned, I want to be clear. There's going to be bruising, there's going to be swelling, okay? And all those things are normal, so you will hurt. Again, I'm not trying to talk anybody out of getting a joint replacement. I think if you need it, you need it. That's perfectly fine. I just want to set the expectations that it's going to hurt, and just because it hurts doesn't mean anything's wrong. It just means you had a traumatic experience, and this is why things feel the way they feel. Now, I've talked about pain and how much it's going to hurt and the reason why it's going to hurt, and all those things are true. But even though it's going to hurt, it's really important that you move. Okay, so years ago they used to promote bed rest was huge, right? Now not so much. So now we believe in what they call active recovery, and what that means, movement is your friend. Okay, so you want to move as much as possible and be as active as possible. Okay, my colleague here likes to say, when you move, that promotes increased blood flow, blood circulation. So that's similar to kind of bringing the groceries in. Okay, and as the groceries, as the nice fresh blood that's full of nutrients and oxygen is being pumped into the tissue, all the waste products that the tissue is producing is getting pumped out, it's getting flushed out. So like my colleague says, you're bringing the groceries in and you're bringing the trash out. Okay, that's really important. Okay, some of the things that we get asked often is, Miguel, is my knee going to split open? Because when you push on it, it feels like it's going to burst apart. The answer is no. All the physical therapists, especially here at Balance, we're trained extremely well, and we've seen a number of knee replacements and hip replacements, and we're very comfortable mobilizing the joint and helping the patient achieve normalized range of motion. So it might feel like it's going to burst open, but it won't. Okay, trust us. It just won't do that. Your surgeon has done a phenomenal job making sure that your incision is nice and secure. Plus, your physical therapist will not be pushing on you that hard day one. Okay, eventually, yes, but day one, they won't be just trying to sit on your knee or your hip. It'll be very, a very well thought out, methodical, progressed plan of care. The other question that we get is, am I going to be able to kneel? And the answer is, it depends. And that answer frustrates some people because they would just want a simple yes or no. But the reality is, everybody's different, okay? And, we've all heard stories that say, oh, well, my neighbor was able to play tennis again a month after her hip replacement. Will that be me too? And the answer is, we don't know. Maybe not. Maybe it might take you a little bit longer than a month. It might take you 2 months. We don't know. All we know is that, we're going to work as hard as we can to get you the outcomes that you want. So after surgery, day one, what's going to happen? So when you go into the OR to have your joint replacement, when you wake up and you're groggy and achy and perhaps a little confused from the anesthesia, there's very likely going to be a physical therapist or a nurse, smiley and happy, and telling you, okay, Mr. Smith, Mrs. Smith, time to get up. We're going to move. And, they're going to be looking at bed mobility, how well you can move in and out of bed, can you roll over in bed, those sorts of things. They're going to be looking at your incision, making sure that everything looks good. They're going to be looking at, can you go from your bed to a chair, things of that nature, bed to a commode, maybe bedside commode perhaps. And they'll be looking at, when you're walking, what do you need to walk? Do you need a front wheel walker? Do you need a cane? How is that going? And they will make recommendations based on how you're doing, on how you're presenting. But the key is you will be doing something, okay? So oftentimes people say, well, just 3 hours ago I was in surgery. Why are you getting me up now? The answer is that's the new kind of protocols for joint replacements that we live in. If you choose to get your joint replaced at Salinas Valley, they no longer use this device which kind of bends your knee and stretches your knee for you. A lot of the research finds that those don't necessarily mean you're better off. So if it's not going to really help you that much, they're not going to use it, which is fine. But caution, so sometimes people develop what they call orthostatic hypotension, especially after a procedure like that. So it's very normal for you to constantly hear a physical therapist tell you, okay, Mr. Smith, just move slow. because that sudden change in going from a seated position to a standing position may change your blood pressure, and you might feel lightheaded and dizzy. We don't want you to fall. So remember, be methodical, move a little bit slower than usual, especially at first, and you'll be fine. Deep vein thrombosis. So oftentimes when somebody is immobile for too long of a time, there's always a risk of developing a DVT, and that's essentially a blood clot. Okay, so that's why we believe in active recovery, and bed rest isn't necessarily the best anymore. John?
All right, so we're going to start with some basic exercises. These are the ones you want to focus on, that you will likely be taught by a nurse that you see right when you wake up, or the first physical therapist that you see. But these are all 5 really focus on muscle activation, range of motion, and then again, it's going to promote what Miguel was talking about, which is using muscles as a pump to get that fresh, nutrient-filled blood to the area that's been just replaced. So, first one here, ankle pump. So that's just where you simply could be sitting down, you can be lying down. All you're doing is just simply pumping your ankles back and forth like that. Quad set, that is where we're trying to get, especially with the total knee, where we're trying to get the leg to be as straight as we possibly can. So if your leg is on the table, you're just trying to push the back of your knee down into the table as much as you can, really activating your quad for that to happen. Glute squeezes, pretty much just like it sounds, you're trying to just squeeze your glutes together, holding and then relaxing. Heel slides, that refers to, again, working on knee range of motion more than anything, but you're trying to just bend your knee, bend your knee so you bring your heel towards your butt and then back out. And then we have the straight leg raise, so that's that bottom picture here, where we're just trying to lift our leg straight up. Okay, so these are the big 5 that you would want to focus on to begin with. In terms of that exercise program, doing this basically every day as often as you can, especially with those basic exercises, because it's promoting blood flow, it's working on range of motion. The more you do it, the better it is. Big thing is that exercise is actually going to provide pain relief as well. A lot of times, we'll see a patient right after surgery and they're like, it hurts to move, I just don't want to move. And the thing you want to keep in mind is that even while you're doing the exercises, yeah, it might hurt a little bit, but afterwards you're going to get a lot more benefit and it's going to make you feel a lot better. Walking. Try to walk as much as you can. This goes for both total hips and total knees. You might be walking with a walker or like a cane or something like that, but try to walk as much as you can and as safely as possible as well. Always remember active recovery. That's the idea of just keeping your joint moving, your muscles pumping. And then always work the opposite leg. It's, you're going to be resting the leg after doing a few reps. So the best thing you can do is just work the opposite side, because you're going to be using that leg a little bit more, and you actually get benefits to that leg that has been operated on. You actually get benefits by working the opposite side to that same side as well. So then looking at the general outpatient physical therapy kind of treatment plan that you would be having at a place like here at Balanced Physical Therapy. So big goals are range of motion. We want to get you back to full range of motion, or basically the same exact range of motion that you have on the opposite leg. Strength, continuing with hip and knee musculature strengthening. So progressing past some of those basic level exercises that we were doing. Functional mobility, so just working on transfers, moving from sitting to standing, being able to get up and down from the toilet, walking upstairs. And there's a possibility during this time as well, you might be working on your low back. If you had your knee replaced, you might be working on your hips a little bit. If you had a hip replaced, maybe your knee and your ankle. Because what happens is when you get this surgery, you develop some compensatory patterns. That makes it so you utilize different areas of your body more, and you might actually have some pain in those areas. So big things to keep in mind. Miguel touched on this a little bit earlier, but that everybody is different. It's even this week I saw two patients that had total knees. One came in and he already had 90 degrees of range of motion. The other one had about 10. So it just shows that everybody is different. They have different levels of arthritis, different levels of strength. There's so many different factors that can play into really your whole plan of care timeline. So don't let your aunt or friend influence the way that you kind of your expectations for the surgery, just based on what their experience was. Comorbidities are always a factor, so things like diabetes, metabolic syndrome, they can play a factor in the how you heal. And your first joint replacement won't necessarily be the same as the second. Similar story where I have a patient that I saw for his first total knee. Second time he comes in, it could be better and it could be worse, or it could be exactly the same. It's really, you don't know what's going to happen. So don't let necessarily your first experience dictate how you expect the treatment plan to go. Muscle soreness is good. We have patients say this a lot where they're, the next time we see them, like, man, I was in so much pain after our last session. And it's like, well, can you describe that? It was like, well, my muscles all around my knee or my hip they were really sore and they hurt. And it's like, well, yeah, that's what we want. That means we're doing the right thing. We're working the right muscles. So muscle soreness is definitely a good thing. And especially now, just due to the COVID-19 situation, maybe a different expectation of when you're in the hospital or in the outpatient surgical center, where your loved ones or caregiver may not be able to be in the facility with you. They may just have to be in the car, and the staff takes you out and then drops you. So just have that be expected, that you may not have your loved ones around you when you wake up. So then looking at exercises again, so as you progress, we want to just continue to challenge you, because that's what's going to get you back to doing the things you want to do. So putting a lot more emphasis on improving your functional capacity by doing things like sit to stand, which is modified squats, deadlifts, lunges, side steps, a lot of high level strengthening stuff that you maybe have actually never done before. But we're going to continue to challenge you and show you things that you may not have realized that you would actually be able to do. So just looking at us here at Balanced Physical Therapy, some of the things that make us a little bit different. So one of the big things that we like to emphasize is the idea of pre-rehabilitation. So it's the idea of starting your physical therapy regimen before you go into your surgery. The benefits of that is that the pre-strengthening results in improved outcomes. So you have that knowledge of the exact exercises that you're going to be doing when you get out of surgery. General expectations for the whole plan of care. Your physical therapist will be able to go through that with you. Also, in terms of our facilities, we have state-of-the-art equipment. We have our Ultra Gs, which is an anti-gravity treadmill. It's great because it can allow us to get back to doing something like running, even though you might not be completely ready for it, by using this system to actually lift you up off of the treadmill. So, for example, we could run with only like 50% of your body weight on that treadmill. And then other equipment like squat racks. We've got our AstroTurf, so you name it, we'll be able to do it for you. And just in terms of our facility as well, the size, all of the equipment, we can really cater it to anybody's needs. Also, along with that, we have therapists coming from many different disciplines, from just general orthopedics to sports rehabilitation, lymphedema, women's health, and pediatrics. We've been serving this community for 18 years, and the biggest thing is that your goals are our goals, and that if you at the beginning are just like, look, I want to just be able to walk my dog, like I used to, and then a few months into it, you're like, what, I actually want to get back into running. We're always going to modify that plan of care and do our best we can to get you back to where you were at. Also, a big thing to follow us on social media as well. We have kind of revamped things, so that we're doing a lot of exercises. This month we are focusing on just joint replacement surgery, or preparing for it. So lots of exercises, lots of explanations of some of the stuff that we were going through today. So each month we're going to have a different topic, or just general exercises out there as well, going over injury prevention, education about other medical conditions, and then upcoming events. So you can follow us on Facebook, just at Balanced Physical Therapy and Human Performance Center, and then on Instagram at Balanced PT Move. So that covers everything, but if anybody has any questions, we'd be happy to answer anything. All right. Yes, please.
I've recently gone on some blood thinners,
Mm-hmm.
like warfarin,
Mm-hmm.
and you mentioned that there's risk of blood clots. Again, I've had 2 other full replacements, knee and hip,
Uh-huh.
and never had a problem before, but just recently I got put on this warfarin.
Got it.
How long prior to the surgery do I need to be off?
That's something that your surgeon will definitely go over with you. I think, and you might be able to touch on this better than me, but I think it's usually like a week or something like that. But, and that's something your surgeon will absolutely be aware of. And so they'll make sure to, take you off of that because, going through the surgery, but then I'm sure that, as soon as things are right, they'll get you back on it as well. So yeah, that's like, again, I definitely would consult with your surgeon because that's much more along the lines of what they would be going through. So
Yeah, I mean, they'll cover all of that, but like about a week sounds about right.
Yeah.
They'll also, and again, with your experience, you may already know this, but that's the reason why they also have you consult with your dentist, for example, because, the metal they use for joint replacements is like a magnet when it comes to infection. So if you have an infected tooth, it'll go right to that joint replacement. And so, the same reason why your surgeon wants you to wait until the very last possible minute before he replaces your joint, because he only wants to do it once. So he wants to make sure that you go, they'll usually give you a checklist of things to do, like go see your cardiologist, go see so-and-so, go see your dentist, go see this and that, just to make sure that everything's checked out perfect and give you the best chances for success.
all right, very cool. Good.
Thank you.
All right.
Yeah. Thank you all for coming. Thank you all for coming.